Hi everyone, Vijay here. We need to imagine everything in relation to what you've had done. So there are phases through healing. So I'm going to split them into 3 phases. I'm going to split it into the first 72 hours, 2 weeks, 8 weeks. If we talk about the first 72 hours, to me, this is the most important period of healing. This is when the body kickstarts the healing growth. And the most important thing during this, there are 3 things that are really important. Thing number 1 is rest. Thing number 2 is rest. And thing number 3 is rest. Try and catch up on all the sleep you've missed out on for the last 20 years in those 3 days, because nothing is going to help the healing more than rest. If we talk about other things that are important, number 1, ice cream. Lots of ice cream. Ice cream has sugar, which means it has calories. It's also cold, which helps with the heat part of the inflammatory response, and it controls any form of oozing and bleeding. People worry all the time that they're going to bleed because of their post-surgery status. There are no major blood vessels in the environments that we work in, and that is assured by how we deliver the implants with a super accurate guide. So we know when we plan your implant placement, we are nowhere near anatomical structures that are going to be a bleeding risk to your general health. The oozing is only because we're working in a highly vascularized environment. Your mouth is a very highly vascularized environment, not the bone, but actually the gum around it. It is a highly vascularized, high turnover tissue. It is designed to be that way because the mouth is permanently abused by food. So it's supposed to turn over all the time, hence a lot of very small, but a huge number of blood vessels. So it's really important that you understand that all of these things interconnect. And it's important that you understand that it's really important to get plenty of rest and eat plenty of ice cream. The next thing on that list is liquids. Water is by far the number 1 thing on the list. Drink as much as you can. The other thing you can think about, if you must, you can have carbonated drinks. Make sure they're cold. The carbonated element is an irritant to the actual surgical wound, which is why we like water. If you want to have squash, have squash. Do not have hot cups of tea. Very mildly lukewarm at best if you must, and definitely not for the first 24 hours. We prefer the softest diet you can stick to, definitely for the first 72 hours. After that, if we move on to the next 2 or 3 weeks, you're going to swell. Swelling is an essential and very normal part of healing. If you don't swell at all, I'd be more worried than if you swelled excessively. The swelling is telling me that there is a massive blood rush to the area. The swelling is telling me that all the nutrients that we need for healing are going to exactly where I want them to go. So it's crucial that you have swelling. Pain. Pain management is important, but we cannot circumvent pain. If you have such a low pain threshold that you couldn't even tolerate something like the feeling of a cut for up to 20 minutes, you shouldn't even be considering this treatment. But if you understand that it's the same effect as when you had a tooth out in the past, and there's a couple of days of discomfort and then it goes away, and you just load yourself up with paracetamol, which is by far the best thing you can do. Stronger painkillers have lots of side effects, and actually they're not great for healing. So really the determinant is not the painkiller, it's your pain threshold, and it's really important that you're open and honest about that with us. If you have a virtually 0 pain threshold, don't do this treatment. But most people, almost everybody, paracetamol is by far more than enough. Next, in the next 2 to 3 weeks, it is really important to keep things simple. Okay? Definitely do not pull your lips out of the way. There are stitches in place. Those stitches are dissolvable stitches, and they will dissolve relatively predictably. But because this is a moving environment, because I've got things like the tongue going on, I've got foodstuffs going in, you will disturb some of the stitches. We already know this. And we use soluble stitches because actually it's far more uncomfortable for a patient to have unsoluble stitches that we bring them back for and actually have to cut out of the mouth. So no matter how uncomfortable you find the soluble stitches, the alternative, which is the unsoluble stitches, trust me, are far more uncomfortable, especially when they all have to be removed, which is why for the last 2 decades, we have only used soluble stitches, and we will only use soluble stitches. Food-wise, we want you to eat, but we talk a lot about the fork diet. The fork diet is really simple. If the side of the fork doesn't go easily through the food, don't put it in your mouth. Lasagna. Have as much lasagna as you like. Have as much shepherd's pie as you like. Have as much cottage pie as you like. I don't mind. But please don't ring me and say, can I have a steak? The answer is absolutely not. Because it's not the steak that's the problem. It's not what we did that's the problem. Your body needs a chance to recover. So actually, if I'm blunt, you're the problem. So we need that all to come back, okay? Then we move from 3 weeks all the way out to 8 and 12 weeks. So the vast majority of patients we have on a recall at 8 to 12 weeks, no sooner, because there's nothing to look at in that period. Because the level of remodeling that's happening in that time, you're just staring at a Kodak moment that will change dramatically within a week. So there's no point taking everything on and off, nothing. What are we looking out for? Simple things. If you get a bad taste, and usually like a metallic-y taste, and it's in the mouth for longer than 5 days, we want to know about it. It's very important, this, longer than 5 days. Intermittent bad taste during healing can happen because it could be something as basic as an old blood clot breaking down, and that doesn't taste great. But if it lasts 5 days continuously, you need to contact us immediately, okay? We've also given you 2 lots of antibiotics. We only want you to take 1. The second lot of antibiotics, we will instruct you to take it if this bad taste lingers for 5 days. It's a clinical choice, it's not yours. So please don't take it, but definitely keep it just until we get you to sign off. Then we see you at sign off. 8 weeks, 9 weeks, 10 weeks, 11 weeks, 12 weeks. There is no one size fits all for everybody. Every single person's biomechanic calculations and healing trajectory is worked out on an individual basis, so the instruction we give you is for you and you alone. So looking at how other people go through the journey, it's just an indication of the overall journey. It's not an exact, because we're not making shoes here. What we're doing here is a highly complex surgical revision and delivering a prosthetic at the same time. Once you come for the sign-off, they will tell you that the implants are rock solid. And let me just put that into context. We are currently trending well over 99% integration at the time of 8 to 12 weeks. That's pretty good. In fact, that's really up there in terms of implant predictability. If you look at all the data on Google that you can search, you'll see that 99% is at the upper end of success. So paranoia about implants failing, actually, it's the thing you should worry about the absolute least. It's almost a foregone conclusion because 99% is pretty close to 100. Once we sign you off, please, by all means, go for a steak that day. They are designed for steaks, so I don't want you to deny the steaks at all. You can go on to the normal broad spectrum of acceptable human diet. Once we tell you the magic words, everything's great, we'll see you in 12 months.